here present will answer to you. But Doc Ben, here are some questions that were already forwarded to me. Can I read it, Doc?
Yes,
Okay.
please go ahead, attorney.
Ito po. What is the best age to get started with NGF and Celergen?
It's a very difficult question because we can only answer based on theoretical facts.
Okay.
Number one, degeneration or aging starts the moment we are born, so they say. But it most significantly has effects on the body's function when we stop skeletal or systemic development, which is when you reach adulthood. But the body starts breaking itself more significantly then when you reach menopause for women and andropause for men. Okay, but andropause and menopause are manifestations of the aging process already. In other words, a disease, these are symptoms na. These are already symptoms. So it would, since andropause can start as early as 35 years old in men, and menopause can start as early as 45 years old in women, it would be best to take them one or the other or both during this period. And like I said, these are just theoretical concepts that we are basing this answer on.
Okay. I hope whoever gave that question, Doc Ben has answered you, right? Okay, sir. Doc, there's another one. How will Celergen and NGF Plus help my cervical spondylosis?
Oh, okay. Well, cervical spondylosis, or spondylosis for that matter, is a general description that we apply on any disease of the spine or any symptom that we think the spine degeneration is causing. So spondylosis may include muscle spasms. It could include nerve pinching. It could include actual nerve degeneration or damage because of a slip disc. And of course, slip discs or discs are made of collagen. So number one, Celergen can help spondylosis, one, through prevention of undue collagen deterioration. Okay, number two, Celergen can help in the inflammatory process that leads to muscle spasms and even inflammation of the nerve itself if it is pinched by a disc. And as far as the nerve is concerned, once the spondylosis is far advanced, that it also has radiculopathy, wherein this is a symptom we describe as when you have shooting pains going down already on your arm or your legs, arms, of course, for the cervical spondylosis, then NGF will help regenerate the damaged nerve. I hope that answers the question.
Okay, Doc, there's another question. I have a pinched nerve on my spine and due for knee replacement surgery, but was put on hold because of a nerve problem. Would you recommend combination of Celergen and NGF Plus as a treatment?
That is a very common dilemma that we orthopedic surgeons face when a patient complains of lower extremity pain, especially chronic one at that. We have to differentiate whether it's coming from a pinched nerve at the lumbosacral level, at the lower back level, or it's really coming from the knee because of degeneration or osteoarthritis. Most often, we can differentiate through clinical symptomatology, meaning assessing the symptoms that the patient gives us or relates to us. So if it's just the knee, then the pain will not be shooting down from the lower back. Okay, so I think the dilemma of the surgeon that is handling her is that he's apprehensive that replacing the knees might not relieve the pain. But I'm sure that if the knee is really that degenerated, meaning stage 4, which is when we recommend knee replacement, then it will be greatly relieved, even if the low back pain is not addressed. So I would assess first, is the knee really that degenerated? We only recommend knee replacement for a stage 4 disease, meaning the bones are already hitting or touching each other and there is no cartilage left for Celergen to regenerate. Okay, and so I hope that answers the question.
Okay, thank you, Doc. And there's another question because, Doc, I'm also cancer
Survivor, yeah.
survivor now. Yes, I'm glad that I did not have to undergo chemotherapy or any radiation treatment. I just had surgery. And this question is that, can Celergen, because I think there are some of us here who have relatives or who have cancers. So can Celergen benefit those who are undergoing chemotherapy?
Um, there is a very viable cancer management support program, and basically this program consists of the three um, modalities or habits that we mentioned during the talk: diet, exercise, and supplementation. So we usually, in this program, we usually confer with the oncologist. So we don't intervene or interfere with the actual management of the cancer patient, but we support the treatment. So we also, since chemotherapy is still the gold standard for most cancers, we encourage the patient and just assure the patient that we will help you with the side effects of chemotherapy. And as we all know, most cancer patients succumb to the chemotherapy because of the side effects. Because chemotherapy kills not only the cancer cells, but also some or a lot of the normal cells around it there.
Yes, yes, I agree with you, Doc. That's why I was so afraid to like to be placed on chemotherapy. And I'm really really glad that I've been on Celergen in 2016, since 2016, when I learned it and when they advised my husband to take it as well. So
So the simple answer to that question is yes, we recommend supplementation highly, particularly with Celergen, or if the cancer is related to the nervous system, with NGF as well. But you have to clear it with your oncologist. Unfortunately and sadly for our medical profession, a lot of oncologists discourage supplementation for their cancer patients. It's not true that supplements can feed your cancers. The fact that your cancer cells are not functioning properly, that's why they're causing disease, is a reason that they will not use your supplements. Your normal cells will be using the supplements to survive the chemotherapy.